Hi guys, this is Curtis Alexander. I'm a pharmacist. In this video, I will be covering Losartan. It's a blood pressure medication, but I'm going to be covering specifically side effects and then 6 warnings you and your doctor need to keep in mind if you decide to go on it. Before I get into that, go to curtis-alexander.com. There's a free report there you will find helpful. A lot of people who come to the channel are looking for options outside of drugs and surgery. I give you the best ones I know and the ones I personally use. So let's hop right into it. So Losartan is what's known as an angiotensin II receptor blocker. And basically the end result of that is it's going to lower the blood pressure, but one of the nice things, it doesn't affect bradykinin as much. And bradykinin is one of those compounds I've talked about in other videos. When people take ACE inhibitors and they get that annoying cough, usually because of bradykinin. So a drug like Losartan will avoid that. It also increases urinary flow rate, but that comes and leads to potential side effects as well, which we'll get into right now. So main side effects we're going to see. Now keep in mind, if you are a type 2 diabetic, these are going to be a little bit higher in all type 2 diabetics, particularly with type 2 diabetic nephropathy. So if you have any kidney issues, we want to pump the brakes a little bit with Losartan and just pay attention to what we're doing because it can increase your chances of side effects. Not high, okay? In studies, we're talking 4%, but it's just important that you know about these. So these are the most common ones. So first of all, we have an increase in potassium levels. Again, some of the increase in urinary flow rates, we're getting rid of certain things which causes an imbalance. So we can see slightly elevated potassium levels. You do want to make sure that the doctor is monitoring those. We can see an increase, again, all 4% on these in studies, of urinary tract infections, which is kind of interesting. Then we have orthostatic hypotension. So when you go from a lying down or sitting position and you get up and your blood pressure drops substantially, orthostatic hypotension, okay? We can see diarrhea and we can see anemia. Overall, I find Losartan is very well tolerated, but those are the side effects that we're most concerned about, that we see the most in studies. Now, warnings. Okay, there's a few of them here. So first of all is angioedema. So it's basically what somebody looks like when they get an allergic reaction, swelling under the skin. Losartan doesn't cause it as much, and we're not concerned about it as much, but if you've ever had a reaction like that to the ACE inhibitor class of medications, we would be concerned, we'd be careful with using Losartan. The next one is aortic or mitral stenosis. Basically, the valves in your heart are causing the blood to not flow as well. That's a group of people we'd want to be careful about using Losartan. Ascites, essentially you'll have a buildup of fluid in the abdomen area. This can be caused by different things, but one of the causes is cirrhosis, scarring of the liver. Usually we're okay to use Losartan in these folks, but in people who have the cirrhosis, we may want to avoid it. So that's something to keep in mind. If you have liver or kidney issues, not that you can't use it, we may have to do a dosage change. This is especially the case in anybody with liver issues. We may have to do that. Finally, race does play a role. In black patients, if you're taking Losartan to lower the blood pressure, we don't see as big of a drop in the blood pressure in black patients. So that's something to keep in mind. Again, we may see a dosage increase there. And then in surgical patients, now there's different kinds of surgeries. This is a very general rule, and most surgeons, doctors haven't come to a consensus on this per se, but usually if it's a non-cardiac surgery, they will still most likely have you continue the Losartan, but some doctors may not. So that's something to keep in mind as well. Okay, so that's everything, guys. That's what I would keep an eye out for, side effects and warnings with Losartan. What I'd like from you, please let me know in the comments. Have you taken Losartan? Did you experience side effects? If so, what were they? Any of these warnings, just kind of jump out at you as something that you've seen before in yourself or a loved one, for example, who's taken it. At any rate, let me know in the comments if you've had any experience with it. It's helpful for the viewers that are on the channel, and it's helpful for me to get your feedback and real world experience with it. So speaking of helpful, I hope the video was, and I will see you in the next one. Thanks.